Hello, good afternoon, everyone. My name is Dr. Halima Alimi. I'm the Executive Director, Restore Foundation for Child Sight. This afternoon, we'll have another public education webinar, which the foundation undertakes from time to time for the purpose of educating the public. Today is a unique one where we have our sixth public education webinar as a Q&A, a question and answer session, a unique opportunity for the public to ask experts in childcare questions that they need answered. And so today we have our panelists, two eminent ophthalmologists who specialize in pediatric care. And so we're going to be doing an intro. And so this is
recording in progress
today. And so today we're going to be having on Professor Adedayo Adio, as well as Professor Nasiru Muhammad. I'm just going to give a brief, very brief intro, summarized. These are juggernauts in the field. So it was a huge task to compress their CVs to what I'm giving you today. So I introduce to you Professor Adedayo Adio. She's a professor of ophthalmology and a consultant in pediatric ophthalmology. She attained her basic medical degree from the University of Ilorin Medical School over 30 years ago, closer to 3.5 decades. And also the specialized fellowships made her an ophthalmologist well over 20 years ago, both the West African and the Nigerian fellowships. And she subsequently has had a wide range of experience of work in different places, Mercy Eye Hospital in Akwa Ibom, and then she was appointed a consultant in ophthalmology by the University of Port Harcourt Teaching Hospital way back 20 years ago, and that is where she still is right now. She attained a long-term fellowship in pediatric ophthalmology, subspecializing in pediatric ophthalmology, strabismus, and neuro-ophthalmology at the prestigious L.V. Prasad Eye Institute in India way back in 2014. She is currently head of Pediatric Eye Care Service at the University of Port Harcourt Teaching Hospital. She also has the ROP screening team. That is a team that screens premature babies for eye problems, and she coordinates the low vision course. She's done that in Port Harcourt since 2017. She also coordinates orthoptics training, which is another specialized part of pediatric ophthalmology. And she's been a past residency training director. That's for people being trained to be specialists, to be ophthalmologists. She's also been a past head of department in the same hospital, and she's the immediate past chairman of NIPOS. NIPOS is Nigerian Pediatric Ophthalmology and Strabismus Society. That's a collection of specialized pediatric eye specialized ophthalmologists in Nigeria. She's on the scientific board and ethics committee of the World Society of Pediatric Ophthalmology and Strabismus. She's a volunteer ophthalmologist at the Lens Rehabilitation Foundation for the Blind and Visually Impaired, also known as TILEC in Nigeria. That's in Port Harcourt. This is where teenage boys and girls are rehabilitated to fully integrate back into society in an inclusive and useful manner. And she's been an author of several publications in local and international journals, and she's herself a journal reviewer. So she is really a giant in the field of pediatric ophthalmology and strabismus. We welcome her. The second person on the panel is Professor Nasiru Muhammad, also a professor of ophthalmology and consultant in pediatric ophthalmology. He attained his MBBS basic medical degree 20 years ago from the Usman Dan Fodio University. And he has since then had specialization into ophthalmology, 2002 with a diploma, followed by a fellowship, and then, also diplomas outside of medicine, public administration and education, and a master's from the London School of Tropical Health and Hygiene in 2016. He is currently a professor of ophthalmology at the Usman Dan Fodio Hospital. He's also an honorary consultant at the same hospital's teaching facility. He's had a long working experience in ophthalmology from Sokoto, Kano, Kaduna, the Gambia, Saudi Arabia for well over 20 years. He's been a past chairman of the Nigerian Medical Association in Kebbi State. He's also been chief resident when he was a trainee at the National Eye Center, that was in 2006, and head of ophthalmology of University of the Dafodio University Teaching Hospital in Sokoto. He's been chairman MD-CAN, that's the Association of Consultants in the same hospital. And up to, from 2018 to date, he's been the Medical Advisory Committee Director of Training and Research at the same teaching hospital. He's been Secretary Board of Trustees of an Eye Care Foundation, also a member of the technical team involved in child eye health, and also the Nigerian National Task Force for the Federal Ministry of Health. He has authored several publications, both in local and international journals. And so today, I give you our experts, Professor Adedayo Adio and Professor Nasiri Mohammed. They're both very welcome. We thank you for making time within your extremely busy schedules and on a day that should be a rest day. And so thank you for making time for our question and answer session. And I welcome everybody to this, what promises to be a useful and stimulating session. Thank you very much.
Thank you very much, Dr. Halima, for inviting us, and we wish you all have a productive and enlightening session.
So the format will be for me to, thank you, Professor Adio is on as well, ma'am. Professor Adio. Can you hear me, ma'am?
I can hear you.
Yes, thank you very much. So, so we're set to start. We already sent forms out, which we have questions already. And so I will allot questions, and then I'll just read out the question, and then I'll just say who it is who will answer this question. So this will be the format. I will start with you, ma'am, Professor Adio. So I have a question that says a 4-year-old has had a red and itchy eyes for the last 1 year. It's worse in the dry season and the beginning of the rainy season. And although he's using eye drops, this person says it hasn't cleared. What should this person do? I will lump that with another question that is related that says, if my child starts to scratch her eyes, should I immediately take her to see an ophthalmologist? So Prof. Ma, go ahead, please.
Okay, thank you for inviting me for this great initiative. I think it's a very good one to allow parents and friends and those who have people that could have eye problems be able to interact with the professionals. So going straight to the question, you said the 4-year-old has a red and itchy eye. And usually this kind of period, when we have the rainy seasons, at least where I live, the problem is a little bit worse. And if you are using eye drops from a hospital, which is recommended, by the way, you are expected to go back for a checkup. But this question says it has not yet cleared. Generally, the eye drops that are given, if you go to see an eye specialist, particularly a pediatric ophthalmologist, or someone who has been working with children for quite a while, they'll give you some medications that will reduce the body's sensitivity to the allergen. Most of the time when these kind of things happen, it's because the body is responding or reacting to some allergen in the environment. And when this happens, especially those who are prone to it, their eyes begin to itch and their eyes begin to have issues. So when this doesn't work, then you have to go back to the doctor and explain. And usually there are signs that will indicate for them to give some stronger medicine. This child is reacting to something. If you can find out exactly what the child is reacting to, then you may not even need any medication. But if you don't know what it is, the best is just to allow a recognized eye professional have a look, examine your child, and make sure you're on the right medication. Thank you very much.
Okay, thank you, ma'am. And so the next question will go to Professor Mohammed. And so I have a question here that says a newborn child developed redness in one eye by the 3rd day after birth. Then the lid in that same eye got swollen for a week. And although the hospital gave some injections, not an eye hospital, the person admits, the color of the eye changed, and then the eye seems to be getting smaller. And so this person is wondering what's going on and what to do. Prof, sir.
Thank you very much, Doctor. Basically, what to do is really to go to the hospital, specifically to an eye clinic, to see an ophthalmologist. Now, looking at the scenario, presentation of red eye 3 days after birth is what we call an infection in a neonate. It's a form of conjunctivitis. Now, by the time the eyelid gets involved, then it means the infection is already spreading into the muscle, the skin around the eye, and that is an indication of getting more serious. This eye getting smaller might not necessarily be the eye is getting smaller. Usually when the eyelids around the eye get swollen, the eyeball will appear as if it's getting smaller. So I want to encourage whoever asks that question to immediately take that child to an ophthalmologist to take a look. It is something that can be pretty serious because infection around that part of the body easily gets to the brain. And if it gets to the brain, it gets more serious. So I really ask whoever sent this question to quickly take that child to the hospital.
Okay, thank you very much, sir. So Professor Adio will be on again. So I have a question that asks, at what age should a child start getting the eyes checked? And a similar question says, how often should my child get an eye checkup, whether he or she has an eye problem or not? And yet another question says, what age should a child start screening their eyes? So yes, ma'am.
Okay, so I think I'll take them one by one. You said say that again. I think I should like to take them
what age a child should start screening their eyes?
Okay, when a child is, before a child even goes home from the hospital, is the first time that the child should be checked by the doctors, especially if before they are born and they have been cleaned and everything. Before the child goes home, they should not focus only on the mother. And then there are some obvious things that people may not notice in the child in terms of the color, the size of the eye, okay? If there's any reflex or appearance that is not very clear to anyone, must be properly checked. And then when they go for their BCG examination or injections also, the eye should be looked at least briefly and be seen. And generally, there should be some kind of person that is available there to do what we call a red reflex, looking for signs of where there's something that is blocking the vision in the two eyes. The two eyes should be straight, and this child should not have any kind of reflex or this one's eye bigger than the other. Now, when the child is now, having done all that, when the child is now 3 years old or about to start school, should have another eye check. And then when the child is 6, should have an eye check. Specifically when they are getting to secondary school, when they're moving from GS3 to SS1, and when they're going to university, they should have their eye check during those. And of course, more often, if they have an eye problem, they must be checked.
Okay, thank you very much, ma'am. I think you've actually answered with that. You've answered all the questions, the sub questions under that. Thank you. Okay, so Prof, sir, you're back on again. Someone wants to know, how do you prevent and treat discharge from the eyes of a newborn? A newborn, prevention and treatment of discharge from the eyes.
The standard thing, any child at birth need to have the eye assessed, at least by the people that receive that delivery. So if that assessment is done at that point, it's a good time to observe if there is any potential problem in that eye, including an infection. Please apologize for the background noise. I'm in an airport. So these are some of the critical things that are expected in a functional health system. any new child needs to be assessed. Now, usually there is what we call a prophylaxis using a tetracycline eye ointment, for example, that is available even at primary health centers because it's on the list of essential health medicines in this country. So it's expected to be available in virtually every health center. So that's one quick thing that could be done. Now, as for the treatment, this has to be done by a health professional, depending on, because there are lots of different discharges that they can be mucoid, it could be really prank force. So all this will determine what choice of treatment the health professional will take decision on. This is not recommended for anyone to just think he or she knows an eye drop or any medication and start applying, especially on a newborn child. So prevention, tetracycline, it's something expected at primary health level, and any subsequent treatment needs to be done by preferably an eye health worker.
Right.
And then I think the additional thing is antenatal care, because some of these infections are acquired through the birth canal during delivery. So mothers attending antenatal care, getting their swabs taken, especially approaching delivery, just to show if there is any infection along the birth canal, this is managed and the whole spread of that infection during birth is prevented.
Okay. Thank you very much, sir. Yes, I think that answered the question nicely. Okay, so Prof. Ma'am, you're back on again. So I have a question that says, how can I detect if my child has an eye problem without it being obvious? How can I tell if it's not obvious?
Okay, if your child is moving so close to an object or the reading material or moves close to the television every time, and your child keeps rubbing the eyes, these are all signs of eye problems. The eyes may not look problematic initially, but these are all signs. And if the eyes are crossed, maybe it's changing from one to the other, and it's maybe just a few times when the child is tired, when the child is angry, or when the child is sleepy, or or just waking up from sleep, the eyes are not straight, then become straight after a while. So those kind of problems, when they're not able to focus. Then sometimes when there's a slight, one eyelid is a little bit droopy compared to the other. Sometimes it may not be very obvious, but these are all signs that there's a problem. When one eye seems to bulge, than the other, is pushing out or slightly bigger than the other, these are all signs that there's a problem with the eye. Another one is when the child does not have any interest in reading. When the child, when you just something to read and then he just doesn't want to look at it, or he's looking away, or when he's in class, you can't even see any notes that this child has written down, and the teacher is complaining that he doesn't pay attention, there may be an eye problem, or he's not doing well in school. These are all signs. Before you label that child as a dull lad, you should have that child's eye checked. And when they're in the sun, sometimes they are squinting one eye. So all these things. And then sometimes when the child is maybe in the night, seems to be bumping into things, bumping into objects, or even during the day is bumping into things, that's a sign that these are all things that you need to talk about. Yeah.
Okay. Thank you, ma'am. And ma'am, you're still going to answer another question, which asks, what lifestyle changes do you suggest to help best manage a child's vision? What should they be doing more or less of?
Okay. 80% of what children learn is from the eyes. And so that is the reason why we have to be very careful with vision, especially in children. And they are our future. And if something happens and something quite drastic goes wrong with their vision, you will notice to take, they live a much longer life, and if care is not taken, you might have a challenge. So exposing them to digital devices and making them to always look at things that are close, not utilizing distance vision, using more of near vision all the time, not allowing them to play. These are all things that they should do. Now, like some of my patients, they'll say, when you tell them that they should not allow them to study beyond 3 or 4 or 2 or 3 hours in a day, they are very happy, But these are very important things. Excessive study is not good for a child. Excessive screen time is not good for a child. And you might note that a toddler or an infant should not even be exposed to any digital device at all. And even online, you can check online and see what screen time is for your own particular child. Want to play outside in the sun. These are all things that have been, found to help a child develop normal vision. If you have exposed them to digital devices too early, they might not be able to, they might develop vision problems that can actually give them problems later in life. Things like myopia, short-sightedness, these are all things that can develop in a child. So lifestyle changes, reduce the screen time, reduce near work, allow them to play outside in the sun, and then make sure that they also interact and not depend on digital devices all the time.
Okay.
Okay, these are all like.
Thank you very much. So, Professor Mohammed, you're back on. Someone asks, there are 3 questions that are sort of related. So I'm going to run them together. One person says, what could be the cause of pus in the eyes, and how can it be treated? Then another person asks, what is the cause of a child always having mucus in the eyes on waking up in the morning? And then the third one talks about reddish eyes and eyes with mucus. What could be the cause if this happens every 2 to 3 months? So I've lumped these 3 questions together because they're similar.
All right, thank you very much, Dr. Ali. I think this question is mainly about redness and mucus from an eye. Basically, it always indicates an infection. Once you have some pus on the eye, it indicates an infection. Now, for this one, every 2 to 3 months, you need to ask, is there tears constantly drooping from that eye? For example, problems around the eye can cause repeated persistent redness from time to time. For example, problems with the eyelashes can cause this, or the tears, as we know it, is water. It has a drainage site at the inner part of the eye. So if a child is born with that place being blocked, the child is likely to have persistent tears running down the cheek. And from time to time, that child will get some infection, and the parent will notice large amount of discharge or pus coming out. So this is one reason that some reasons that could explain frequent discharge from an eye. Children with this itching are also prone to repeated discharge from time. Like earlier, we answered a question relating to itching. Now, most itching, as you see it, is allergy. It's a form of allergy. So looking after that, it's a disease that can be controlled, well controlled with good care and medications. So if you control this, you reduce the rate at which your child will be having frequent pus coming out of the eye. Somebody getting injury from anything can cause that. Using harmful medications can cause this, or people using all this urine or saliva or breast milk. All these are problems that some communities practice that can predispose these children to red eyes, to infections. But basically, you see any pus, there is an infection. But most infections will not occur just like that. There is usually something that is bringing that germ or making that germ to be aggressive to cause a problem. So they are better avoided. And if you notice them, please seek help from a health facility. Where there is an eye clinic, preferably. Where there isn't, you should access a health facility for appropriate assessment and treatment.
Okay, thank you, sir. So you're still going to answer another question, as you know, that says, to prevent infection after eye surgery, how long must my child stay off school? I know there are different types of surgery, so I want to go ahead and inject. What if it's a cataract surgery, which is an invasive one? How long is it safe for the child? I mean, how long does the child have to stay away from school just to prevent eye infection?
All right, so basically for a cataract surgery in a child, we're all mindful that this is a child. So the way we manage cataract surgery in a child is different from we manage it in an adult, simply because of this knowledge that this is a child. This is not someone you can give instruction, do, and the person will do, don't, and the person will done. So we actually take extra caution during surgery in children to ensure these problems do not come about. So a straightforward, uncomplicated surgery in one eye with the other eye seeing normally, I mean, I can see that child in 2-3 weeks, depending on the age, can actually go back and continue school. For somebody much smaller, who even the parents at home have extreme difficulty controlling and managing, obviously will have to stay longer for a month or 6 weeks before one can safely say it's okay to allow the child to be unsupervised. Because it's all about being supervised. And then many a time we have medications that have to be applied. At those 2-3 weeks is quite frequent, but from 3 weeks, usually it's less frequent. So these are periods that it's possible, but please always discuss it with the doctor managing your child to tell you that he or she thinks your child can resume school.
Right. Thank you, sir. Okay, so Prof. Ma, you're back on. Someone asked, what could be the cause of yellowish or reddish eyes in a 13-year-old? I mean, these are two different colors. I don't know why they're lumped together, but that's the question. Yellowish or reddish eyes, 13-year-old.
Okay, someone has yellowish eyes usually indicates that there's a problem with the liver, and that needs to be checked out by a professional. Sometimes when the bilirubin levels, which are part of the waste products in the liver, is too high, then you can have the bilirubin, which looks yellow or stains tissues yellow. You can have it staining the eyes and the face yellow, and then it goes directly to the rest of the body. So somebody who has yellowish eyes definitely may have a serious condition and needs to be evaluated by a physician. So that is very important. That there's nothing to say a teenager cannot have liver problems. So such a person is not a local problem, especially if it is involving both eyes. If it is involving just one eye, it's possible that there may have been some kind of injury to that eye and there was some blood that's accumulated locally, which is breaking down. And part of the breakdown products is this, the turns yellow, makes the white tissues in the eye turn yellow. Another condition we will consider benign that could cause the eyes yellow is when the child may have malaria. If a child has malaria, there could be some slight staining of the tissues of the eye as yellow. Of course, a sickler also could have yellow eyes from not handling blood properly. So definitely all this goes by a physician. Back to you, Ali.
Okay, thank you, Ma. And yes, can you still hear me, Ma? What about the red one, the reddish eyes? If the eyes are reddish, what are the options for what could be caused?
Okay, if the eyes are red, it could be a sign of trauma, which is part of the answer. I said sometimes if there's a direct hit to the eye, some blood can show, and then it can break down. Then some other areas, especially if it's uniformly red, it's where there's an infection. And I think Professor Mohammed has handled that. An infection can happen to anyone. And of course, there are some types of infection that can happen. Affection of the eyes that can turn the eye red from an affection of the tissues within the eye. And if it is associated with problems with light sensitivity and some reduction in vision, you really, really need to see an eye doctor. You can't just stay at home. Any kind of redness must be attended to by an eye doctor. So just make sure that person sees an eye doctor. That could be a local problem. That's when I say local, around the eyes. And so that needs to be attended to very, very seriously by an eye doctor. Don't treat yourself at home.
Thank you, ma'am. Okay, so Professor Muhammad, someone asked, a child who doesn't see well at night, could that be called night blindness? This is the whole extent of the question. Maybe you want to just elucidate on this.
All right, thank you very much. Yes, it's night blindness. Somebody who doesn't see well at night, that's what night blindness is all about. Now, the question is, what could cause it? Now, there are preventable causes, there is a treatable cause, and there are causes that there isn't much treatment for that poor vision at night based on the cause. Now, generally, vitamin A deficiency is the commonest problem that you find that can affect a larger number of children, for example, and just having a balanced nutrition that includes simple things like carrots, eggs, fish, meat, liver. These are vitamin A rich foods, vegetables, just some home gardening things, not so complicated. Having them and your child is taking them gets adequate vitamin A to prevent that night blindness. Now, in the case the person has a deficiency state, then that person's night vision can be affected. This is basically because vitamin A is important to all of us to see clearly at night. So if your body is not having enough, so those mechanisms in us that enable us to see at night are ineffective, are not able to assist you to see well. So just treating that person with vitamin A will restore that problem, and so that the body has enough to do all the processing it needs to do. There is adequate in store for that. Now, there are other diseases that sometimes run in families that children can be born with, or sometimes a problem affects the woman in pregnancy, and the light sensitive part of the inside the eye gets affected, and that child, right from a tender age, will have poor night vision. And unfortunately, at this point, there is no tentative treatment. There's a lot of research going on to find solutions for this, but at best it's still at research level. There are some trials, but it's not yet something that is available for someone to just go and have. So essentially, it's preventable. There are forms that are treatable, and there is a form that the person just needs to be adapted to how he or she functions at night.
Right. Thank you very much. Sir, I'd like you to clarify regarding vitamin A. Some people have the habit of just going randomly to the chemist or the pharmacist and just buying vitamin A to use randomly. Is this advised? When you talk about vitamin A, are they supposed to go to hospital and get particular dosage in, or should they form the habit of just randomly taking vitamin A, considering that it's a fat-soluble vitamin? I just want you to comment on that, sir.
Yeah, it's extremely important, really. Now, I mentioned prevention. If for many of us, we're aware that in the immunization schedule, they have this vitamin A supplementation. Now, that is a preventive effort, because some people are not able to take those foods that I mentioned earlier due to their own peculiar circumstances. So there's a large availability of supplementation to enable children have adequate stock of vitamin A. Now, in a deficiency state, it's also a different dosing. Now, this vitamin A that we see, it can actually kill. If you abuse vitamin A, it can kill. So people need to know that yes, you can use vitamin A to treat it, but you need to get to the hospital they will give you a clear schedule of how that dosing is done. Because sincerely, that vitamin A, you see, you may just give it and you just see the person going into coma. You lose consciousness. So it's not a drug to just play around. Thank you for raising that up.
Thank you, sir. So, Professor Adio, someone says, my child is an albino and always reads with the right eye. What is the cause and what's the way forward?
Okay, people with albinism usually have, they are at a higher risk of developing problems with their vision because of this lack of pigment. You know, when you look at them, they're a bit fairer. In fact, it's not just fair, they're a bit almost, the skin is like there's no pigment at all. There's no blackness at all. And you know, there are also European albinos also, you know, there are also American albinos that were already white and they are also albinos. So it's not just in black people. You know that from the color of their hair, completely white, you know. So because of this lack of pigment, you know, when they are being formed as a baby in utero and also through infancy, this lack of pigment prevents their eyes from developing normally. And this is the crux of the problems that they have. The wires from the eye to the brain, it is not wired properly because pigment is really needed in making sure that this wiring is successfully, you know, laid down, so to speak. So if that is problematic, they will not be able to have good vision. So common problems that they could have is light sensitivity, what we call photophobia. They could also have refractive errors like astigmatism. That is when the shape of the eyes are not particularly, you know, equal. Instead of it being a smooth sphere, it's more curved on one area. There's sometimes they may have short-sightedness, hyperopia, that's long-sightedness, and then they could also have problems with color vision itself. And so all this combination of problems, in addition to the fact that the eyes are not properly developed, there's an area of the eye called the macula, which may not be properly developed in these people. So they could have what we call low vision. And such people usually need to have special glasses and assisted vision using devices, what we call low vision aids. And sometimes, you know, if they don't know that they need all this, they usually suffer through school and even in interacting, going out in the sun, they suffer from the photophobia, the excessive sun that is entering their eyes unrestricted. There's this part of the eye called the pupil that we have, those who are pigmented, that blocks excessive light. It gets smaller, then it filters off excessive light. It gets wider, it allows light to come in. But in them, their iris is the pupil is not pigmented. So it just allows light to enter unfettered, unfiltered, you know? So when this happens to them, they really suffer a lot. And so that is one of the reasons why they have that. So somebody could have albinism and be seen very well only with one eye, depending on how well the vision is. So such a person should be supported by an eye doctor. A parent has to take that child to see an eye doctor. And when that eye doctor sees the patient, they are properly or thoroughly examined, looking at the glasses that they could have, and that other problems that they could have also in terms of color vision problems, in terms of the type of glasses power that they could have, in terms of the photophobia, combating it. So once all this is taken care of, and they also see a low vision specialist, usually they will have a better time. Apart from the other problems that they could have with the skin, these are the problems that they could have with their vision. Thank you.
Okay, thank you, Mark. So there's a follow-up question about when a child totally loses vision or a young person. Because I know that you're specialized in that aspect of life, I need you to tell people what happens when a child's vision is so low, too low for any of these devices to really be of help, any longer with conventional education the way we know it. So what would be your advice for such a group of people? How can they get help and where?
Okay, it's very important for us to note that everything is not just all about vision, perfect vision. If that child is not able to use the vision, or the vision is not very useful, after trying every possible means, seen a specialist. They've checked that it's not a surgical problem, it's not an optical problem, it's not a medical problem, and they've taken all the steps and still the vision is too low to function in class. Then what the child should have is to have what we call vision rehabilitation. You should not keep that child in a school and be pushing them from class to class without being properly schooled in the methods of accessing information without depending on vision. If you do that, you're not helping that child. If that child needs to now do public exams, that's where the child will now stop, because the child does not have the means to access those public exams. And of course, they will not allow you to get the brother or the sister to come and start doing the exam for the person, you know? So what you are expected to do is allow the child to have at least a year or two of vision rehabilitation, and they will be schooled in the methods of using assistive devices. It will interest you to know that there are a lot of things like converting text to speech, that these softwares that the children can use so that they can also hear, especially if they don't have any hearing problems, they can hear this, whatever it is, information you want to give, and they can also give you information back on their own by typing out the answers to any question that is given to them. So learning, we're not learning all this. So any child who has low vision, that is too low to be able to access get better with device, or does not have any vision at all, whether it was born, his child was born like that, or he becomes like that, should have rehabilitation. Anybody less than 10 should have that, and anybody older than 10 should have 1 year, less than 10, 2 years, so that they are properly schooled in giving all this, giving information and accessing information. After that, this child can now go to school with other children who are sighted. That is the world, that's the international recommendation. They should not be kept in a blind school. Children who cannot see should not be kept in a blind school just because they cannot see for the whole of their educational year. That is not fair. That is like excluding them from relating with other people. Okay, now what happens when they now finish their education? They now have to interact. You have kept them away for most of the important part of their learning years, the formative years, away from other people. So if you see a blind school outside this country now, or in all these other places, they are just a resource center. So once they learn how to get this information, they put them in schools we call inclusive schools, where they learn alongside those who are sighted with a special education teacher to make sure that they are following the methods that have been taught. That's what they should do. So you shouldn't be afraid. If you have a child that has that problem, it's not the end. You might be surprised that this child may even do better than any of your sighted children. So don't worry, we have the means to do that. Dr. Alimi can connect us. If you're around us here, we are in Port Harcourt here, TLEC Rehabilitation Center. We can do that for you. And we also help those who also become blind later in life. Maybe they've acquired a degree or they are doing their master's. Anyone that loses vision, we also help people like that to get back on their feet. So if you have any questions, if you have any comments or anything that you want to, any questions that you have, just contact us through Dr. Ali Mishinu, how to get us connected. Thank you.
Thank you so much, ma'am. Thank you very much for that response. I believe I have one more question left. And that will go to Professor Mohammed. You've sort of answered it already, sir, but just because it's been asked, it's still the same question about having discharge and puff in a child living with hydrocephalus. I don't think it's any different from any other person, but it's been asked. So I'm going to put the question to you, that a child living with hydrocephalus has a watery discharge and pus. What should they do?
So like we mentioned earlier, once you have pus, just know that it's an infection. If you have just tearing without a pus, it's not likely to be an infection. But once you have pus, there is an infection and it needs to be treated. So you need to get to an eye clinic. They will assess, pus is of different type. You can have a pus that is just mucus. You have some discharge that is a mixture of real pus and mucus. You can have a discharge that is just pus. And sincerely, like that pus is an emergency. For that kind of pus can destroy the eye within hours. So you need to get to the hospital. The specialist will assess the type of pus that child has and manage it. It's not different, like as you said, from any other child without hydrocephalus. It's an infection and it's something that can be treated and get rid of.
Thank you very much, sir. I want to say a big thank you to both Professor Adio and Professor Mohammed for this unique opportunity to interact with people on this platform. Thank you both of you. Thank you everyone for coming to this all important program. Right, so thank you so much. I'd like to end this by saying a hearty thank you to the two profs, Professor Mohammed, Professor Adio, who have so kindly made out time for this important session. Thank you so much, and we hope that you will oblige us whenever we call on you again. And I'd also like to thank the audience for being there. And we want to say that we're streaming live on YouTube, so we hope that we can send out these recordings to anyone who wants it, because we want the message to get to as wide as an audience as we can reach. So thank you everyone, both panelists and the audience, for being here. Thank you, Prof. Adio. Thank you, Prof. Mohammed.
It has been a pleasure.
Thank you. Thank you so much.
Thank you so much. We're grateful.
Wish everyone well.
All right. So
all right, bye-bye.
I wish everyone a nice day. Enjoy the rest of your day, and please watch out for the next webinar, which might come up in a couple of months or 3 months. Thank you, everyone, and bye.
Okay.
Bye-bye.
Bye.